It's time now for our weekly checkup with Dr. Isaac Bogoch. Dr. Bogoch, Happy New Year. How were your holidays?
They were initially difficult and then relaxing. I was working for the first half, had the second half off, did absolutely nothing, hung out, stayed in Toronto, went to the outdoor ice a lot.
Nice.
Spent time with the family. It was great. How about you?
Yeah, pretty much the same thing. And now it's getting back in the swing of things, waking up early. So thank you so much for joining us. It's good to see you in the new year. Dr. Bogoch, as you probably know already, it's been a pretty nasty flu season. A lot of people getting sick. First, I want to talk about, though, this mutation or mutated strain of influenza A, H3N2 subclade K. This hit Japan, the States pretty hard. What do we know about this strain and what it might be doing to the trends we're seeing this season?
Yeah, I mean, listen, the flu virus, first of all, there's 3 flu viruses that circulate seasonally. They all mutate. That's just what they do. They do this every year. They're going to continue to do this for the foreseeable future. That's what viruses do. And that's why the vaccine is slightly different every year. The flu virus mutates. We try to catch up with the vaccine, and it's a bit of an arms race. This year, the vaccine does not cover H3N2 as much as we would like. It still has some protection, just not as much as we would like. And remember, when we talk about protection, we're not just talking about protection against infection. We're also talking about mitigating severity of infection if you do get an infection and had the vaccine. So again, not as good protection as we would like, but still some protection. But that's one of the driving reasons why we're having such a difficult flu season, is because of all the 3 circulating flu viruses out there. There's mostly H3N2. There's still the other 2, but it's mostly H3N2. And number 2, the vaccine isn't providing as much protection as we would like, but still has at least some protection.
Yeah. Okay. So there's a narrative out there that, hey, you can still get the flu even if you get vaccinated. But your message is still get the flu shot because it does offer you more protection than if you don't have it at all. Correct?
Yes, and it's for 2 reasons. Number 1, it's not like it provides zero protection. Remember, there's 3 circulating flu strains out there. Yes, it's mostly H3N2, but it will still provide pretty meaningful protection against the other 2 circulating flu strains, which admittedly are less frequently encountered, but still encountered. And then number 2, we're not just talking about preventing infection. We're talking about mitigating severity of infection as well. And again, the flu shot doesn't work as well as we'd like this year, but still has some protection at an individual level and at a population level. It makes sense. But there's a caveat to that, right? Listen, the flu season is going to start winding down. There's still a long road down to the end of the other side of the mountain. We probably peaked sometime over the holidays. And we'll get updates from Ontario and Canada Public Health in the near future. But we've probably peaked. But that doesn't mean the flu season's over. It still means there's a lot of flu season left, probably a couple of months. And remember, it takes about 10 to 14 days after you get a flu shot where you're provided with some protection against it. So, if you're asking me today, should we still get a flu shot if you haven't received one already? The answer is probably yes. But as we move through January, the answer is sort of like, it's not really going to provide as much protection because flu season's starting to wind down.
Okay, Dr. Bogoch, very quickly, we've had reports of severe outcomes in young children. Sadly, we've seen 8 flu-related pediatric deaths. We know that it can affect older populations. How does vaccine protection differ across age groups? And should certain populations consider additional measures beyond getting vaccinated?
Well, there's no secret in how to protect ourselves from respiratory viruses, right? We know the vaccine is helpful, but of course, it's not the only tool we have in the toolbox. While mandates are long gone, you can put on a mask, and a mask will reduce your risk of infection. There's no question about that. And I think sometimes the discourse around masks confuses individual health with population health. I don't think we should get into it now because we don't have a ton of time. But yeah, masks can reduce your risk of infection. You also can improve the quality of air in indoor environments to help reduce the risk of transmission of viruses that are transmitted through the air. So there are additional measures. And of course, policy at a city, provincial, national level that enable people to stay home when they're sick is also helpful. So you don't go and get the entire classroom or workplace or hockey locker room or whatever sick. So stay home if you're sick. But again, easier said than done. Policy to enable that would be helpful.
Yeah. Okay, Dr. Bogoch, that is our time for today. Thanks so much for joining us. Have a great week ahead, and we'll talk to you soon. Take care. Thank you.
Happy 2026.
You too.